Hi, Dr. Federo here. I'm a board certified plastic surgeon, and today we're going to talk about rhinoplasty. So this is a very pleasant 29-year-old woman who came to my office with basically two complaints. She doesn't like the fact that her nose is crooked, and you can see that the nasal bones are off to the right. And she doesn't like the fact that when she looks at her profile pictures that she has this bump. So her primary cosmetic issues are that she has a bump and her nose is crooked. When I ask her about her breathing, she tells me that she can't breathe through her nose, and she hasn't been able to breathe through her nose since she broke it as a child. So the goals of the surgery are to make her nose prettier, straight, get rid of the bump, to make the tip and the bridge more harmonious, but also to restore her nasal airway. So typically patients will say, well, what can my nose look like? So what we do is we take the image, her pre-op picture, and you can see here, this is her pre-op picture, and the nose is deviated to the right side. So our goal is to make the nose straight. So using the computer software, we do a morph. And in the morph, you can see that the nose is now straight. So this is just a simulation. And she likes this. So the goal is to make her nose like this. So after the surgery, when she's all done, you can see that her nose is now straight. And I would say that this image is better even than the morph. So in this case, the simulation is not as good as her actual post-op result, and she's very happy with having a straight nose. So when she initially presented, we took her picture, and you can see that she has a very prominent bump, which she does not like. So we took that image, and we morphed it, and here is the simulation with a straight bridge and a refined tip. And here is her post-op view. And I think that this is a softer, prettier, more natural result than even the morph. So in this case, I think we exceeded expectations or exceeded what we could show in the morphs. Okay, so typical questions that people ask is, okay, what exactly are you going to do to my nose to make it this way, and how are you going to make my breathing better, and what's the recovery like? So for most of my patients, I tell them they need about a week off. So you have surgery, say, on Tuesday. And then for the first 24 to 48 hours, you're going to feel a little bit beat up. Yeah, you may have a bit of a sore throat. You may have a bit of an upset stomach. You're going to have swelling, but it's not terrible. And what I have my patients do is ice the nose for 2 or 3 days, take a little bit of pain medicine and a little bit of Motrin. And after 3 or 4 days, people are pretty comfortable, but you're socially unacceptable. You're not going to want to go out, and you're not going to want to go to school or go to work. And after 6 days, I typically will remove the cast and take out any splints that are inside the nose. And at that point, you look pretty good. You may have some swelling, you may have some bruising around the nose, and you may have a bloodshot eye, but you're pretty reasonable. And at that point, you can return to normal activity. So if you give me a week, I can give you a new nose. Typically don't need more than that. If you're very concerned about being bruised, then you may want to stay out 10 days. 2 weeks would be the most you'd ever need for the recovery. We can talk a little bit about how I made her nose pretty. So in the actual operating room, what I do is, so we go to the operating room and I do an open rhinoplasty. I make a small incision between her nostrils, and I expose the tip and the bridge. And the first thing I do is I address the septum. So this is a representation of the septum, and it's made up of cartilage here and bone. And to make the nose straight, you have to straighten the inside. So the first thing I do is I trim a little bit of the cartilage from the bottom. That lets the septum move into the middle. And then typically there'll be some deviation in the central portion of the septum, which is made up of cartilage and bone. So by removing this cartilage and trimming it, the septum can be brought into the middle. So this allows me to start to straighten the nose. And it also gives me some building material that I can use to make the nose prettier later. The next thing that I do is I do a little bit of work on the bridge. So this represents me removing some bone and some cartilage, and this represents removing some cartilage from the tip, and these little sutures represent the sutures that I use to reshape the tip. So what I'm doing is I'm modifying the bridge and the tip, and I like to do a little bit on the bridge and a little bit on the tip and go back and forth so that the bridge and the tip blend together so that it's a harmonious relationship. And in this case, I added a little strut of cartilage. So the cartilage was removed from her septum and I put it here. And this just helps to stabilize this new construct. And then you see this little representation here that's a little graft, and that's just to make the tip a little more elegant and to give it more durability, because I want the nose to be beautiful for the rest of her life. So it has to have strength. Now, if you look on this picture, The nasal bones, we know, were deviated to the right. So in order to bring them back in the middle, I needed to make some cuts in the bone here and literally reposition. So when she broke her nose as a young woman, the nose broke and the nasal bone shifted to the right, and they were allowed to heal there. So now what I have to do is I have to re-break the nose and put them back in the midline. Once that's done, there's a tendency for the nose to collapse, so you want to make sure that that doesn't happen. So I added a little bit of cartilage here. They're called spreader grafts, and what that does is that creates a space between the sidewall and the septum. So not only so she can breathe better, but also that the nose will have an appropriate cosmetic width, because you don't want a nose that's too thin, functionally or cosmetically. And then I close it up. So my practice is Northeastern Plastic Surgery, and we are in Florham Park, New Jersey, and I would love to have you come in and talk about having your nose done.